My name is Tejumade Abib.
My name is Nadia Ali.
And my name is Elizabeth Marcus, and this is our Pharmacoeconomic Evaluation. So the article that we used was the cost-effective analysis of lesinurad/alpurinol versus febuxostat for the management of gout/hyperuricemia in Italy. So is the title of the study appropriate? The title of the study includes the comparators, which is the combination of lesinurad and alpurinol versus febuxostat. It includes the country that the study was done in, Italy. It mentions the study type. It is a cost-effective analysis. It also mentions the disease, gout/hyperuricemia. The setting, it's not mentioned in the title, but it is the Italian healthcare sector, and there's no apparent bias in the title. Was a clear objective stated? The core pharmacoeconomic question of the article is the objective of the study was to evaluate the cost-effectiveness of lesinurad/alpurinol in comparison with febuxostat as a second-line therapeutic strategy for the management of patients affected by gout and hyperuricemia that did not respond to first-line therapy, which is alpurinol alone. Use and implications of the study perspective. The perspective of the study is that of the Italian National Health Service on the lifetime horizon, and this was directly stated in the article. Because this is a government perspective, we expect it to include healthcare costs as well as the costs of other public sectors. This type of study presents a broader perspective than that of the payer perspective, but not as broad as that of society. For relevant costs, direct costs were associated with the various health states, the various health states in the model which the patients were in. The article lists mainly healthcare and monitoring costs to the Italian healthcare sector and takes into account frequency of visits/examinations at 1 to 6 months and every 6 months, as well as price, acute costs, and cost per acute event. Costs related to hospitalizations, outpatient visits, and diagnostic tests were valued, referring to the year 2014. The economic burden of specialist visits and tests were determined. The defined daily dose cost was calculated for alpurinol, lesinurad, and febuxostat. These were all direct medical costs. The study also included costs of other patient treatments with gout medications such as colchicine and NSAIDs. While the article does take into account the appropriate costs associated with the healthcare sector, more about public sector costs of gout could have been included, such as loss of productivity due to potential limited activity and disability that can be seen in gout patients.
What was the relevance of the outcomes in this study? The outcome used was quality-adjusted life years, also known as QALYs. It was an appropriate outcome measure. It's important to incorporate the improvement of patients' health-related quality of life gained, as well as proportion of patients who were treated successfully. The authors noted that desirable health states was associated with lower concentrations of serum uric acid in blood per deciliter. However, they did not explain why these specific cutoffs were used. Would even lower cutoffs show a more desirable health state? That was not explicitly explained in the article, and this may have been clinically useful to the reader. What was the relevance of the outcomes in the study? And it's a continuation. The authors discussed adverse effects. According to the authors, none of the adverse effects had a significant impact on the patients. No disutility values were used in the analysis. The authors also used the adverse events to compare the consumption of resources per adverse event while comparing lesinurad, alpurinol versus febuxostat. It was practical that the authors related the data to years. Gout/hyperuricemia is a chronic condition which may have varying severity depending on the season and their budget impact analysis that made a provision on both the treatments of using 3-year time frame. Also, using the Markov model helped to break up the analysis into cycles, which helps to better represent the nature of gout/hyperuricemia. The adjustments and discounting methods. Costs related to hospitalization, outpatient visits, and diagnostic tests were referred to the year 2014. According to the authors, enhancement of cost were related to the Italian Pharmaceutical Handbook. Due to economic burden, specialist visits and diagnostic tests were determined by rates found in the Italian tariff nomenclature for specialist outpatient services. The authors noted that Italian tariff nomenclature are renewed over long time intervals, therefore pricing was referred to the year 2017. The authors did not define what long refers to, however. Overall, the authors could be more clear and direct as to what year the costs were valued. It is not well defined to the reader. The quality assumed a discounted rate of 3.5% for both the costs and benefits. This rate was based on scientific literature. They did not go into further detail. What was the impact of study assumptions? The authors noted that some assumptions were made based on lack of data. The authors assumed the perspective of the Italian National Health Service in lifetime horizons. The authors also noted that other assumptions, and this was quote, several assumptions were made due to the lack of data of febuxostat. Some of its rates of moving from specific health states towards others were assumed to be equal to those of lesinurad/allopurinol. Therefore, this may have caused an underestimate of the treatment effects of febuxostat. Lastly, the authors set the threshold to 30,000 euros per quality. This was done to assess the economic acceptability. This value was based on existing literature as well as assumptions due to the absence of specific recommendations on its value. Lastly, in terms of other assumptions, also in the final results, they assumed that the three transition rates were used. Serum uric acid less than 10 to serum uric acid 5 less than 6, from uric acid less than 6 to serum uric acid greater than 10, and of the remaining serum uric acid greater than 10 health state, and that these two variables were equal to 0 from the base case. So they were moving from one transition to another, and they had to assume the serum uric acid levels for the study. And lastly, the impact of study results on clinical practice. With the results of the study, the authors were able to show that allopurinol/lesinurad is a cost-effective second-line alternative for those who have not been well controlled or intolerant of febuxostat or allopurinol alone. In terms of clinical practice, the data used is taken from the Italian context, therefore it may or may not apply across all populations with gout or hyperuricemia, and generalization may not be appropriate.
Impact of sensitivity analysis. This study used one type of sensitivity analysis, a one-way and a multi-way Monte Carlo analysis. The analysis was used to validate the robustness of the results achieved. This type of analysis is used to account for the variables in the model proposed by the study. Outcomes of this particular study were measured in terms of qualities and costs. These values were discounted at a 3.5% yearly rate. An incremental cost-effectiveness ratio, an ICER, was used to express the results. In the study, only costs were used for the actual analysis. Using the analysis allowed investigators to determine a willingness to pay of the reference economy. Study limitations. This study acknowledged several limitations. The study uses data only applicable to an Italian market. The model cannot be generalized to other populations, nor can it account for differences in these populations. Due to lack of sufficient data on the medication febuxostat, the investigators had to make assumptions regarding moving from one health state to another. It was assumed febuxostat is similar to lesinurad or allopurinol in this respect. Investigators claimed that this was the only major assumption made regarding the comparison of the two regimens, and thus there only exists a marginal impact on the final results. However, this may have reduced the cost effectiveness of lysinurate allopurinol. Conclusion. The comparison of the two regimens found lysinurate allopurinol to be more cost-effective than febuxostat as a second-line treatment for those suffering from gout hyperuricemia. Lysinurate allopurinol offers 0.16 more qualities when compared with febuxostat. However, it is more costly, incremental costs of 12.4 euros. Additionally, this regimen demonstrated a greater efficacy than febuxostat. The ICER of lysinurate allopurinol compared to febuxostat is 77.53 euros. Lysinurate allopurinol demonstrated economic sustainability, being below the threshold of willingness to pay at 30,000 euros per quality of life year. And that concludes our pharmacoeconomic evaluation. Thank you.